because of the structure of UCSF. We attract people from all over the world in all kinds of disciplines. We've got great scientists. Our MDs, our dentists, our nurses, and pharmacists get trained together, and so it's really had a significant impact on healthcare, not only in California, but throughout the world.
We do this because we are providing a unique and much-needed service, not just for the citizens of San Francisco, but really for people who benefit from our research.
People look to us for the next trend, the next initiative, not only on the education side, but also on the research side. So we are driving the engine, we're driving the train for the country.
I was really drawn to UCSF because I knew that everybody on the campus was going to be a doctor or a nurse or a physical therapist and was going to be having the same values and desires to help people as I did. I really decided that if I was going to go into dentistry and pursue this as a career, I had to do it because I really wanted to be able to give back to people and see the people that were in the greatest need.
UCSF, from very early moments in my training as a medical student, put me in situations that were multidisciplinary. It wasn't discussed, it was the norm.
All of us are aware of this culture of service, that it is just part of our DNA here. So much of what we do is trying to improve the entire community. We're right in the middle of the Bay Area in Silicon Valley, so there's lots of opportunity to interact with industry and professionals that are highly creative and innovative from other worlds. For example, we became very interested in video games, and we are now experimenting with mechanics in video games that allows us to use them as diagnostic tools and therapeutic tools so that we can learn about the brain in a very dynamic way.
I came here in '63 as a graduate student because this was an outstanding place in pharmacy. I'm a drug person, so somebody that's good in drugs and understanding and coming up with new concepts is going to be attractive to the industry. And in addition, you're probably going to make discoveries that lead to new companies, and that's what happened. So UCSF has been very supportive of the faculty in terms of encouraging this interaction with industry. It's extremely valuable.
As I think back on my career as a nurse and a scientist, I think about the motivation for starting the work that I did. My dad was diagnosed with head and neck cancer and died in intractable pain. 4 years after my dad died, I worked as an advanced practice nurse in an academic medical center, really striving to develop standards and guidelines for patients to improve the management of pain. So my early work, and it still continues today, is to try to understand pain as a symptom. No place in the world like UCSF in terms of being able to interact with the top people in the country and get projects done that are going to make a difference for the care of patients that we serve. Why do you think the symptoms would happen early in the morning?
It wasn't until I came to UCSF that I ever really had a professor who had made tremendous discoveries in the health field or was doing crazy, ridiculous research, and I'm like, wow, I can't believe this person took, an hour out of their day to lecture me just as a first or second year student.
One of the objectives as a faculty member is to have your students and your postdocs be able to think on their own and have the confidence in themselves that they feel that they have this base that allows them to then go forward.
Our students come out confident and competent in a way that others don't. We immerse our students in the technical aspects of diagnosis and treatment, but also take very seriously the application of it and the aspects that are technical and the aspects that are social or fall into an art form.
I tell my graduate students that the real advantage of UCSF, and something that we're really proud of, is the most interactive campus in the world. If they have a problem and they want some help at another department or another laboratory, just go talk to them because they'll help you.
Some people say transdisciplinary, some people say multidisciplinary, some people say interdisciplinary. We make it alive in UCSF. It's not a textbook definition.
I think that UCSF is like a big think tank. It's the Silicon Valley of health because you're around people all the time that you can bounce ideas off of. I can meet up with a medical student for lunch and talk about an idea I have for a proposal, and he'll have a totally different take on it.
In 1982, UCSF started the first AIDS clinic. The San Francisco model was a multidisciplinary, one-stop shop, community-based system. That comprehensive approach was the best, most responsive delivery of care to this emerging new disease in the country. UCSF did not blink, did not hesitate to accept the charge that it was theirs to respond to. There was no looking around for who should take care of this. It was us.
One of the things I have found most rewarding is our ability to take care of children who otherwise would not have great access to medical care. My work is mainly focused on children with leukemia. I do both laboratory and clinical research, and the mission of the research is to take novel genomic discoveries from the lab and bring them into clinical practice or clinical trial. Childhood cancer obviously doesn't just occur in San Francisco or in the United States. So the work that we're doing at UCSF ripples out to affect clinical trials all over the world.
So there's a history of people here trying to say, this is a new way of looking at things, and this is the way we ought to do it. And that's what the School of Medicine did, School of Dentistry, School of Nursing, School of Pharmacy did. They brought in the best people that they could find, and they created an environment to bring excellence.
I think we create an atmosphere here where students feel a part of history. And in a sense, they're creating history too.
We all feel it and we all want to be a part of it. That's what makes it special, is that you feel the strength of the history that came before you, but also this incredible enthusiasm to move forward.